Welcome to the deep dive. Today we're getting into something a lot of you with pets might face. Cataracts.
Mhm.
Basically, it's when the lens in the eye gets cloudy. Could be just a spot or, the whole thing.
Right, an opacification.
Exactly. We've got some great info here, and our mission really is to break down what they are, the main reasons they happen.
The why.
Yeah, the why, who gets them most often, and importantly, what can actually be done about it. Sort of a quick way to get informed on the key stuff.
Okay, sounds good. So maybe start with a normal eye. What's a healthy lens like?
Good idea.
All right. So imagine these tiny, tiny fibers, really precisely arranged, all lined up perfectly.
And that's what makes it clear?
Exactly. That alignment lets light pass straight through, no scattering, total transparency.
Yeah.
And it's got like a structure, a cortex, and a nucleus,
Okay.
all wrapped in this clear capsule. And interestingly, the eye keeps making new lens fibers constantly throughout life.
Huh. And how does it get fed, so to speak?
Through the aqueous humor. That's the fluid inside the front part of the eye. Provides all the nutrients.
Gotcha. Okay, so if that's normal,
Hmm.
what goes wrong when a cataract forms? What's the basic issue?
Well, fundamentally, it's a disruption. A derangement of those neatly arranged lens fibers.
A mess up.
Pretty much, yeah. And it can happen for a few reasons.
Yeah.
Maybe changes in how lens gets its food, its nutrients.
From the aqueous humor.
Right. Or issues with its energy, how it handles proteins, or just, the fluid balance inside gets thrown off.
Okay. Now, the material we have really points to genetics as a huge factor, especially for dogs.
Oh, absolutely. For dogs, genetics is the most common cause. By
What?
far.
Really?
Yeah. And it's known in so many breeds. The info mentions over 135 where it's suspected or established.
Wow.
And usually it's what we call autosomal recessive, meaning the dog needs two copies of the bad gene, one from mom, one from dad.
Okay, autosomal recessive.
It's also seen in Himalayan cats. Same inheritance pattern. And what's kind of striking is how common it can be in certain breeds, like up to 10% prevalence.
10%. That's huge. It really highlights the breeding aspect, doesn't it?
Definitely. Responsible breeding is key there.
Okay, so genetics is big for dogs. The other major one discussed is diabetes. Diabetes mellitus.
Especially in dogs again. And the mechanism is quite specific.
Yeah, they talked about the sorbitol pathway.
Exactly.
Yeah.
So you have a diabetic animal, their blood sugar is high, hyperglycemia.
Right.
That means more glucose, more sugar, floating around in the aqueous humor and getting into the lens itself.
Okay.
And the lens's normal way of using glucose just gets overwhelmed.
Yeah.
Too much sugar.
So it goes somewhere else.
Precisely. It gets shunted into this alternate pathway, the sorbitol pathway, and it produces sorbitol.
And sorbitol, that's the problem.
That's the problem. Sorbitol creates this osmotic gradient. Basically, it pulls water into the lens,
Yeah.
like a sponge.
So it swells up.
It swells, the fibers get disrupted, disorganized, and bingo, cataract, often very rapidly.
And dogs are more prone than cats? Something about an enzyme?
Yeah, aldose reductase. That's the enzyme needed for that sorbitol pathway to really kick in. Dogs just have more of it in their lenses compared to cats.
I see.
Which makes cats much more resistant to getting these diabetic cataracts. The info even suggests most diabetic dogs will get cataracts eventually, almost no matter how well the diabetes is controlled.
Wow, that's sobering. So diabetes is a big one. What else? Uveitis was mentioned. Inflammation inside the eye?
Right, anterior uveitis.
Mm-hmm.
That can cause cataracts too.
How does that work?
Well, a couple ways. The inflammation itself can mess with the aqueous humor, change its composition, affect nutrient delivery to the lens.
Okay, disrupting the food supply again.
Kinda, yeah. Or sometimes you get more direct effects, like if the iris sticks to the lens, that's called posterior synechia.
Right.
That or just inflammatory gunk debris can land on the lens surface and cause cloudiness there. So inflammation elsewhere affects the lens.
Interesting how interconnected it all is. The source also lists, well, a whole range of other things.
So, yeah, it's quite a list. Shows how sensitive the lens can be.
Like trauma.
Yep, trauma's on there. Think like a cat scratch puncturing the lens capsule. Especially in younger animals, that can definitely trigger a cataract.
Ouch.
And you have just getting old. Senile changes often starts as this dunce bit in the middle, nuclear sclerosis, which we should talk more about.
We should, yeah. People confuse that one.
They do. But then older dogs can get actual spoke-like opacities forming too. That's a senile cataract.
What else? Congenital?
Present at birth or soon after. Could be genetic again, or maybe something happened in utero or related to other eye problems.
Okay.
Even things like previous eye surgery, certain drugs. Ketoconazole was mentioned. Toxins from retinal degeneration, radiation,
Wow.
low calcium, weirdly enough,
Mm.
nutritional issues in pups or kittens, even electrical shock. It's a surprisingly long list.
It really is. So just to recap, the who gets it? Primarily dogs, right?
Right.
Way more than cats.
Definitely. Dogs are the main ones affected, and we mentioned those 135-plus breeds with genetic links.
And age. It can happen anytime.
Pretty much any age. Genetic ones can pop up really young, 6 months even. Senile ones, obviously, in older pets.
Right.
So yeah, it's a leading cause of blindness in dogs, super common if they're diabetic, but relatively rare in cats.
Okay. So we know the who. What about the what to look for? What might an owner actually see?
Good question. The most obvious thing is usually that cloudiness. A white or hazy look to the pupil where it should be black.
Okay.
They might also notice vision loss.
Right.
Bumping into furniture, maybe hesitant on stairs, especially if it comes on quickly in both eyes. That's typical for the diabetic kind.
Right. The rapid onset.
And with diabetic dogs, sometimes the owners notice the other signs first.
Yeah.
Drinking tons of water, peeing all the time.
The polyuria, polydipsia.
Exactly. That might show up before the eye changes are obvious.
And when the vet takes a look, they can stage it, tell how advanced it is.
Oh yeah, definitely. There are specific stages. Incipient is the earliest, just small spots, doesn't really affect vision much. The vet can still see the back of the eye fine.
Okay.
Then immature, it's cloudier, more diffuse. Vision might be a bit affected, but the vet can still get some view of the retina, the fundus.
Right.
Mature means totally opaque. Can't see the fundus at all. The animal's functionally blind in that eye.
Complete blockage.
Yep. Then hypermature is sort of breaking down. The capsule might look wrinkled. Sometimes bits liquefy or get mineralized. Oddly, if enough liquefies, sometimes a little vision can return through the clear fluid.
Huh. Strange.
And there's one more specific type, intumescent mature. That's the swollen one we see with diabetes,
Yeah.
where the lens rapidly sucks in water and gets bigger, making the space in front of it, the anterior chamber, look shallow.
Got it. Now, you mentioned nuclear sclerosis earlier. That's the one that looks like a cataract but isn't, right?
Yeah.
Super important distinction.
Crucial distinction, because nuclear sclerosis, or lenticular sclerosis, is just a normal aging change. Happens in most dogs and cats, usually after age 6 or 7.
So not a disease.
Not a disease. It's just the old lens fibers getting compressed in the center, the nucleus. Makes it look a bit hazy, bluish-gray maybe. Owners panic sometimes.
I bet. So how does a vet tell the difference?
Well, with sclerosis, the cloudiness is perfectly round, right in the middle, symmetrical in both eyes usually. And the key thing, when the vet dilates the pupil, they can still see the fundus perfectly clearly through the hazy nucleus.
Ah, okay. Light still gets through.
Exactly. And it almost never causes any real vision problems. So no treatment needed, just reassurance for the owner.
That's really good to know. Okay, so if it is a true cataract, what happens then? What are the options?
Well, first things first, if the pet has lost vision, you need to think about safety.
Right. Making adjustments.
Yeah, blocking off stairs, pools, decks, keeping them on a leash or in a fenced yard outside, just preventing accidents.
Makes sense. And for actually treating the cataract, surgery comes up a lot.
Yes, surgery is really the only way to restore vision lost to cataracts.
Yeah.
And the good news is, it's generally very successful.
What kind of success rate are we talking?
Usually around 80 to 90%, and a high success procedure in the right hands.
That's pretty amazing.
And owners should know, once the cataract is removed, it's gone for good. It doesn't grow back.
Oh, right. You take the whole lens out?
Well, the cloudy contents of the lens, usually leaving the capsule behind to hold an artificial lens.
An implant.
Exactly, an intraocular lens implant, or IOL. That replaces the focusing power of the natural lens and can restore really good functional vision.
And is early surgery better?
Generally, yes. Evaluating them early is ideal. It can help avoid complications that might develop as the cataract matures, like inflammation or glaucoma, which could make surgery riskier or even impossible later on. Plus, it gives everyone time to plan. And sometimes you can skip extra tests, like an eye ultrasound or an ERG, that's an electroretinogram, test retinal function, if you catch it early enough.
What's the main surgical technique called? A phaco.
Phacoemulsification, yep. That's the standard of care now.
How does that work, basically?
It's pretty cool, actually. The surgeon makes a tiny incision in the cornea, maybe 3 millimeters. Then they use this ultrasonic probe.
Ultrasound.
Yeah, high-frequency sound waves. It breaks the cloudy lens material into tiny pieces, emulsifies it,
Okay.
and then it simultaneously suctions those little fragments out of the eye. Very controlled, minimally invasive.
Wow. And recovery.
Usually involves a few weeks of taking it easy, no rough play, and definitely eye drops. Lots of eye drops to control inflammation and prevent infection.
Mm.
But pets often start seeing much better within days.
Are all cataracts good candidates for this?
Not always.
Yeah.
Inherited ones, diabetic ones, senile ones, usually great candidates, assuming the rest of the eye is healthy.
Okay.
But cataracts caused by, say, ongoing uveitis, the inflammation one, those often have a poorer prognosis because the underlying inflammation can cause complications after surgery.
Right. And what if they can't put an implant in?
Good question. Sometimes the capsule that holds the lens is damaged, or maybe the lens has shifted. If they can't place an IOL, the animal will still be able to see after the cataract is removed.
Just not perfectly focused.
Exactly. They'll be very far-sighted, but they'll still have functional vision. Way better than being blind from the cataract. It's still a huge improvement.
And you mentioned trauma earlier, like a cat scratch. Is surgery urgent then?
Yes, if the lens capsule is actually punctured and lens material leaks out, that causes severe inflammation very quickly.
Yeah.
So immediate surgery to remove the damaged lens is usually needed to save the eye and vision.
Okay, so surgery is the main fix. What about medications? Do eye drops help the cataract itself?
Not really for the cataract itself, no. Meds are mostly used to deal with the consequences of cataracts.
Like inflammation.
Exactly. Lens-induced uveitis. When lens proteins leak out from a mature or hypermature cataract, they can trigger inflammation.
So anti-inflammatory drops.
Yep, topical NSAIDs, non-steroidal anti-inflammatories, or sometimes steroids, depending on severity. The source mentioned maybe preferring NSAIDs in diabetic patients if possible,
Okay.
and sometimes topical atropine to help with the uveitis, but not if the pet also has glaucoma, because atropine can make glaucoma worse. Oral NSAIDs might be used too.
What about those antioxidant eye drops you sometimes see advertised, claiming to dissolve cataracts or stop them?
Ah, yes. The information we looked at is pretty clear. There's currently no solid scientific proof that those topical antioxidant drops can actually reverse cataracts or even significantly slow them down.
That's probably not worth it.
Well, the bigger concern is that relying on them might make people delay getting a proper surgical evaluation.
And then complications could develop.
Exactly. Waiting too long could mean missing the best window for surgery or letting inflammation get worse, potentially making the surgery less likely to succeed.
That makes sense. Was there anything about future medications, maybe for the diabetic kind?
Yes, a brief mention of topical aldose reductase inhibitors. Remember that enzyme in the sorbitol pathway?
Right, the one dogs have more of.
So the idea is eye drops that block that enzyme could potentially slow down or prevent diabetic cataracts in dogs. It's still in the research phase, but it's a hopeful area for the future.
Interesting. Okay, so after diagnosis or after surgery, follow-up is important.
Absolutely critical. If it's an early cataract and you're watching it, regular checks are needed to see how fast it's progressing and decide on surgery timing and to watch for complications.
And after surgery?
Post-op monitoring is intense, especially in the beginning. The veterinary surgeon will have a very specific schedule of rechecks. Sticking to that and the medication schedule is vital for a good outcome. That needs to be really clear to the owner.
Got it. Can owners do anything to prevent cataracts?
Well, for the most common type in dogs, the genetic ones, the main thing is prevention through breeding.
So don't breed affected dogs.
Right. Avoid breeding dogs known to have hereditary cataracts or known to be carriers if testing is available. For other types, like diabetic ones, controlling the underlying diabetes is ideal, though we know it might still happen. Avoiding eye trauma helps prevent traumatic cataracts. But many types aren't really preventable.
Okay. What about things going wrong? If cataracts are left untreated or even with treatment, what are the risks, complications?
Yeah, several things can happen. We mentioned lens-induced uveitis, that inflammation from leaky lens proteins. That's pretty common with advanced cataract.
And that can lead to other problems.
It can. Chronic uveitis can lead to secondary glaucoma, increased pressure inside the eye, either because the inflammation messes up fluid drainage, or sometimes a swollen intumescent lens physically pushes the iris forward and blocks drainage.
Glaucoma. That's serious.
Very serious, can cause blindness itself. Another risk, especially with hypermature cataracts or sometimes rapidly forming ones in young dogs, is retinal detachment. The retina at the back of the eye pulls away.
Also very bad for vision.
Definitely. And lastly, if a hypermature cataract shrinks a lot, the little fibers holding it in place, the zonules, can weaken and break. Then the lens can actually fall out of place, lens luxation, into the front or back of the eye. causes big problems.
Wow, okay. So not treating them isn't always benign. What's the usual course then? Do they always get worse?
Most cataracts do tend to progress over time, yeah, but the speed varies hugely. Some stay small for years, others become mature in weeks or months, like the diabetic ones often do.
And the prognosis, long-term outlook.
After successful surgery, the long-term prognosis for vision is generally really good. Many pets get excellent sight back.
That's great news.
But there are factors that increase risk. If there was already bad uveitis beforehand, or if the breed is prone to glaucoma anyway, or if the retina wasn't perfectly healthy, those cases might have more chance of post-op complications.
Okay. So wrapping this up, what are the main takeaways from our deep dive?
Well, cataracts mean the lens gets cloudy. Lots of causes, but genetics and diabetes are really big ones, especially in dogs.
Dogs get them way more often than cats.
Right. And recognizing the signs, but also knowing how to tell it apart from just normal aging, like nuclear sclerosis, that's key for owners.
And surgery works really well most of the time.
Yep, phacoemulsification with an implant offers a great chance to restore vision and really improve quality of life. Early evaluation is definitely best.
Okay. So here's something to maybe leave you thinking about.
Yeah.
We talked about direct causes, right? Genes, diabetes, messing with sugar metabolism. Pretty clear links. But what about less obvious connections? Could things like, say, chronic low-level inflammation elsewhere in the body, or maybe subtle dietary things beyond just blood sugar, could they slowly, over time, affect the lens environment, play a role in long-term lens health and clarity?
That's interesting, like the whole body system affecting this tiny structure.
Exactly. It just makes you think about how complex these biological systems are and maybe how much we don't yet know about all the interconnected factors influencing eye health. Something to ponder.